Sandy Kirkley would be very proud and in fact insistent that her work was being carried on. It was very important work, and the fact that we have this Kirkley Centre is a real tribute to her. The work was clinical trials, which at the time she started doing this was a little bit new to the orthopedic surgeon.
The Dr. Sandy Kirkley Centre will be the nerve center for multidisciplinary, citywide research in bone and joint diseases. The center will provide office spaces for scientists, fellows, graduate students, as well as a meeting area for symposia, seminars, and workshops. The Sandy Kirkley Centre is a unique facility that will bring together researchers from a broad range of disciplines, including orthopedic surgeons, biologists, engineers, imaging scientists, and health scientists. We have an outstanding group of musculoskeletal researchers in London, and they're strongly motivated to work together to find solutions for joint injuries, arthritis, osteoporosis, and other bone and joint conditions. The vision of this group of researchers is to maintain lifelong mobility, and I'm confident that we'll see significant advances in our understanding of musculoskeletal diseases and in the development of new therapies and surgical techniques coming from this group in the next few years.
Describing the key partnerships that exist between Lawson, UWO, and LHSC is actually quite easy. When you look across our system, it's quite an integrated hospital and research community. LHSC brings to the table strengths on clinical research. LHRI brings to the table strengths that link together our basic biology, imaging, and some of our disease foci. Within the university, and particularly through the Schulich, what we offer are further strengths that expand on the imaging, expand on our cell biology and basic knowledge. So as you begin to look across the system as a medical research community, it's a very strong relationship. So what does the future hold for us? It's actually an incredibly exciting time to be in the medical community here in London. You know, when we look at our education abilities, our research, the hospital structures, and the leadership that's in place for that, if you look at what's coming to us in terms of an aging population, the healthcare issues that are going to have to be dealt with right away, we are perfectly poised now in London to be leaders in answering those questions, and we will be. This centre is a critical component to that.
It's a humbling experience to think of the amount of time, energy, effort that donors and volunteers have put in to bring this program to life. The Dr. Sandy Kirkley Centre and the Endowed Chair are two wonderful ways to keep Sandy's memory alive and to honor her commitment to collaborative research.